Misconceptions about colorectal cancer can keep people from accessing the preventative care and treatment they might need. Today, we're asking Dr. Landmann, a colorectal cancer expert at Baptist MD Anderson, about the top misunderstandings and misconceptions that they encounter about this disease. Welcome to First Coast Living. Thanks for joining us.
Thank you for having us here. We appreciate it.
Yeah, so let's get started first. What exactly is colorectal cancer, and what are some of the misconceptions about the screening process?
Sure. There's actually two types of cancer. There's colon cancer and rectal cancer. We commonly lump it together and call it either colon cancer or rectal cancer. It's basically a malignancy of the lower intestines. One of the most common misconceptions is that the only way to get screened for this colorectal cancer is a colonoscopy. We do have newer screening tests and newer screening modalities that make it easier to get screened, even in the privacy of your own home. We have tests that just check out the DNA within your stool. So you go to the bathroom and you send in a portion of your stool, and they can get tested that way. We also have flexible endoscopies. However, for the most part, once one of those tests do come back positive, then you do need a full colonoscopy.
Right, and now typically we hear about colorectal cancer in elderly patients, but is that the case? I mean, is there really an age that you need to be looking out for this, or can it kind of spread around?
Sadly, you need to be looking at it at any age. Though screening has helped decrease mortality of colorectal cancer by 50%, we have seen in the age group of 40 to 50-year-olds where the increase in incidence, occurrence of colon cancer has gone up by double, from 6 to about 12%. We've seen colon cancers in patients as young as 18 to 20, all the way obviously to 70s, 80s and above. So we really can't neglect the symptoms of colorectal cancer in any age.
Right, and so what are some of those symptoms?
They can be things as simple or incidental as rectal bleeding, abdominal pain. Many people have changed in their stool habits. They either go more frequently or less often, or the size of the stool, the caliber, has gone down and become pencil thin sometimes. So anything that kind of lasts a little bit longer than a couple of days should probably be seen and evaluated by your physician.
Yeah, and so now obviously there's so much to know about these types of cancers, but what is the most important thing that you want our viewers at home to know about this?
Well, basically, colorectal cancer is almost 100% preventable. We can actually cure patients with a screening colonoscopy. It's perhaps the only screening test in America that we have that can actually cure patients' cancer. Even though I'm a surgeon, I'd rather prefer not having to operate on patients. So get screened according to guidelines, and if you have symptoms, don't blow them off. You can save your life by a simple test.
Now, Baptist MD Anderson recently unveiled their brand new facility. Yes, so exciting. Now, talk about the care that you're giving your patients.
So I think one of the reasons I joined Baptist MD Anderson is because we can now provide the most unparalleled top cancer care in the Southeast region. We're only one of 7 and the only one in the Southeast region affiliated with MD Anderson Cancer Center, which is the #1 cancer center in the hospital. And by recruiting top faculty from all over the country, we're the only ones in this region that really can provide the #1 preeminent cancer care in a holistic fashion and have all the partners come together to provide our patients, our community, the cancer care that they deserve.
That is amazing. I mean,
awesome.
You need that technology to save lives every day.
It's a wonderful opportunity. We love working here.
All right, thank you so much.
Thank
you. Special thanks to Baptist MD Anderson for sponsoring this segment. For more information, you can visit baptistmdanderson.com or simply call 1-844-632-2278. You can also find them on Facebook. Their page is Baptist MD Anderson.